I think what was really interesting was one, the number of patients that that actually saw palliative care throughout their course. So less than half of the patients in our group saw palliative care at all during their disease course. I also thought that it was interesting of the patients that did see palliative care, less than a third of them saw palliative care within two diagnosis. So even with the previous data that early palliative care referrals led to improved quality of life and outcomes, we weren't necessarily seeing that same trend in palliative care referral patterns in our patient cohort, which could be for a lot of reasons, probably beyond the scope of our interview today, including patient preferences, preconceived notions, barriers to palliative care referrals, really just kind of overall disease burden and clinical course. But I think that was one major result. Another one being, I think we had about a 59% of the patients who passed away in our study, about 59% were enrolled in hospice, which we actually thought was a pretty good referral rate. And then the big takeaways, the key end of life care outcomes that we were really focused on was time on hospice, aggressive end of life care, and then in hospital death. And we ultimately found that in patients who saw palliative care early, they had longer time on hospice, they had lower rates of aggressive end of life care, and they had lower rates of in-hospital deaths compared to different groups of patients based on timing of palliative care referrals, whether they only saw palliative care in the hospital or if they didn't see palliative care at all. So those are the big takeaways from our study. I think it was to be totally forthcoming. Our specific groups had low sample sizes, so none of our results were actually statistically significant. But the number, like for instance, in our early palliative care group, there was an average of about 54 days on hospice, and you compare that to 20 to 30 days in different groups. So whether that's late palliative care referrals or not seeing palliative care. And we kind of saw similar trends flesh out throughout aggressive end of life, receipt of aggressive end of life care, and then hospital death as well.